I'm Ben C.,
I'm Dr. V,
the medical legal guys.
Today we're going to be talking about MedPorts and the complications of MedPorts and the litigation that we are involved in.
What are MedPorts?
A MedPort is a medical device that allows easy access to the central venous system so that medications can be given with just simply sticking the port with a needle. Picture a miniature hockey puck that is hollowed in the center of the puck. If it goes underneath the skin, you can stick a needle into that port and give medications through that port, because that port is also connected to...
They're port catheters,
Yeah,
right?
they're port catheters.
Explain what a catheter is.
A catheter is IV tubing. If you get an IV, it's a tubing that goes into a vein, the heart. Okay, so you have ports that go underneath the skin. You have the tubing that then goes into a bigger vein so that people can get medications very easily. The people who get these port catheters are generally very sick people. They often have cancer that they need to have chemotherapy that gets into their central vein, cannot tolerate nutrition by mouth, or they've lost significant amount of their bowels so that they can't absorb nutrition. So they have to get IV nutrition.
They're not able to swallow the food and get the nutrition from the food itself like that. Right?
Yeah,
you have to get it somewhere else.
It's much more healthy to take food by mouth. If you can't take food by mouth, get a feeding tube through the stomach. But people who require IV nutrition, IV chemotherapy, those are very sick people. And the complications from ports are generally infection, fractures, and blood clots.
Why do blood clots form when you're talking about this tubing? That's the catheter part of it. And then you've got the port, which is the hockey puck, right?
Correct.
So how does it happen that these side effects or these effects can develop?
Those are great questions. So if you have a tubing, then these tubings are usually silicone or polyurethane. Those tubings connect to the hockey puck and go into a central vein. Those tubings, they cause an immunological response where the body understands that it's a foreign body. And when it causes a foreign body, it causes a foreign body reaction, and platelets then adhere to the tubing and they form blood clots. Okay, so now there's safer materials that prevent platelets from adhering to the tubing. So it decreases the rate of blood clots. And if you get a blood clot with a device, those blood clots can occlude central veins. Those blood clots can then travel through the heart into the lung, and you could have a pulmonary embolism. Having blood clots are bad deals, obviously. Polyurethane and silicone tubing, because of the foreign body reaction, it causes kind of a fibrous sheath where there's kind of like a scar tissue formation along that tubing. And the more scar tissue you have, there is a tendency for that scar tissue to then get colonized by bacteria. So then you get infections too. The newer materials prevent bacteria from adhering to the tubing. So we're suing on behalf of people who are chronically sick, who have complications from blood clots and infection from these lines. And if you get an infection of the line that goes into the central vein, that's a very bad problem. Okay, that causes sepsis. It could cause death. It could cause an ICU stay, low blood pressures, brain injuries, and all sorts of problems. In terms of the hockey puck complications, these complications of the hockey puck, you could get clots within the hockey puck. The hockey puck can then sometimes flip.
And migrate,
Flip. And if it flips, then you have a person who has big time medical problems having to have another surgery to fix that. And if you have surgery and you're immunocompromised, then the hockey puck could get infected. So there are safer materials that prevent a lot of these complications. These materials have been available for over a decade, but they're still implanting inferior materials into people who should have the safest material because they're sick. Profits over safety.
Two concepts that come to mind. First of all, it's the material. And I'm going to guess that when you say profits over safety, if there's a product on the market and it's been on the market for years and the company finds out, product has problems, but we want to pull this product off the market because it's a moneymaker, right? And then let's say inserted within that idea is that the company has also become aware that there is a safer alternative. Safer means or methods, okay? Meaning safer material, less dangerous material. But here's the rub. It's difficult for that company to want to give up that profit because it takes time, effort, and money, a lot of money sometimes, to develop this new product. So they may continue to market and sell the bad product knowing that there's a better product. Make sense?
Well, in this case, it's a little bit worse that this technology has been available for over a decade, and one of the companies bought the technology and shelved it.
Which company was that?
That was BD.
Becton Dickinson.
This is called super hydrophilic technology, and the concept has been around since the 1980s, and there are safer devices that are available.
Hydro meaning water, right?
Right.
And philic meaning good with water, right? If you're using these catheters, if you're using these hockey pucks, if you're using these ports, you want them to be hydrophilic. They get along well with water because we are water.
And bacteria and platelets, they are repelled by hydrophilic. Okay, so you're not getting the bacteria colonization of the tubing, which reduces infection, and you're not having the platelets adhere to the tubing, so there's a prevention of clots.
When those platelets are adhering to the tubing, and when you've got this clotting going on, that's called hydrophobic. Think of phobia, right? If you have a phobia to something, you're afraid of it. You got a phobia from heights, right? You don't want to go on a tall building, just like this. Hydrophobic means, hey, I don't want to go there, right? So you got a hydrophobic product. Can cause blood clots, can cause infection. Infections can lead to blood clots, and you can actually ultimately damage the material because it does not get along with water. And we are water.
So these concepts have been around. There's safer materials on the market. The worst thing about this, one thing that was really, I find irritating, is that some of the best literature that is coming out, the safer materials, they're coming from China. They are looking past the United States cash cows, and they are developing safer tubing for a purpose, okay? If you have safer products, your people aren't going to get septic shock. They're not going to be in hospitals for weeks on end, and it's greater safety for the people. So, why are the US companies not going to the safer materials? Why are these studies coming from China? We need to be the place of innovation. We need to be the place of safety, and profit over safety does not work.
Does not work for the betterment of
the patient, the public, and we should always be working towards better products, better medications, better avenues of care. And we're not doing this in terms of this medical product. Certainly it's good business for us, but we just find it despicable conduct from our manufacturers.
Manufacturers are responsible for putting on a safe product, putting a safe product on the market.
It's the right thing to do. And for these companies to be using 1950s technology, 1960 technology, these companies need to be producing the best medical devices to prevent complication.